Hi everyone, my name is Wemimo and I'm also known as that mom of five. Welcome back to my channel. In case you are new here, welcome. And I'm just gonna go straight to the video. As you all know, I am currently a second year student studying adult nursing in the University of the West of Scotland. So today I've come in here to share my experiences of nursing, clinical placement, and my experiences so far on if it was a deal. I mean, I would say it's a hard journey. So I'm just going to dive straight into the topic. My first step placement was in an elderly ward whereby patients who have actually suffered stroke or who are living with Parkinson's disease, they get rehabilitated in this ward. And the second placement I had was in a cardiac ward, and the third one which I had was in the cardiothoracic ward. So disclaimer there, just to protect for the safety of the patients and safety of the staffs, I won't be giving names of the hospital where I had my placement, just to be sure that I am not putting myself in arm's length, or I'm not jeopardizing my future registration to become a registered nurse by divulging informations that would mean I am breaking confidentiality. So I just want you to know that in case you guys are like, oh, what hospital did you go to? I'm sorry, I won't be giving out those details. So first thing first, in terms of types of placements differ. There's two types. So it could either be in the ward or in a community. In a community means by you are in a community sector whereby you're going to patient houses to see them. You are seeing patients in the community, either in a GP surgery or in an outpatient hospital or clinic. That's one when I say community. And when I say placement in a ward means that just like the nurses, when you get admitted to an hospital, where in a ward whereby patients are in there, nurses are in there from 7 a.m. till half 7 at night. So that's like a 12-hour shift. So basically a living nurse. So you go in the morning, I don't get to leave until 12 p.m. So my three placements so far was in an hospital ward. So I'm just going to run you through each and every placement which I had during my first year. So like I said, the first placement which I had was an elderly care ward, which look after and care for patients, elderly patients mostly, who have either suffered stroke or who are living with Parkinson's disease or any other age-related long-term condition. So this person was actually, I would say it was like an intro, like a taster to clinical placement for me, as I've always had a care experience because I went to college and I studied some pre-nursing courses. So that was not my first placement, but while at uni, that placement was my first ever placement. So I would say this placement was quite tough for me. Reason being that, one, the distance where I live is quite far. I have to leave home very early in the morning, around 4:50 in the morning, so as to be on time. You have to be on time at everything you do. So mostly what nurses resume at half 7 in the morning. So if I have to be on time, I have to leave home for 4:50 in the morning, and by the time I get to my place, it's about 7 o'clock. So I know I'm on time, and by the time I finish, I don't get back home until 8 o'clock or half 8 at night. So that was the reason why I said that placement was a very difficult one for me. I struggled in terms of time and travel, and by the time I get home, I'm just exhausted, and the next thing I want to do is jump on my bed. So my experiences so far in regards to staffs, patients, mentors, I would say my mentor was absolutely fantastic. She's a very lovely lady, and every member of staff were great as well, except for one. You know, everything cannot always go smoothly. So when I said except for one, it has to do with one of the healthcare assistants. I was not quite happy when I required their help, and they did not come help me. So I spoke to my mentor about that. She was quite good, and she was able to deal with it. So every time we go out on a placement, when we go back to uni, we are allowed to reflect on our experiences. So I remember in class I mentioned this incident involving the healthcare assistant, and my tutor did say to me, did you contact the uni to let them know about that instance? And I was like, no. Reason being that I already spoke to my mentor and she dealt with it straight away. So I didn't think it was something I need to let the university know about. My tutor did say to me, should such incidences happen again, even though my work placement or my mentor has dealt with it, I still need to let the university know about it. So that being said, like I said, that placement was like a taster for me. So you get to learn or you get to see, because most of the time you can't really do majority of this other than taking patients observations, like checking their temperature, taking their blood pressure, taking their respiratory rate and stuff like that. Those are basic things I did mostly on that placement. And other things that I did involves personal care, like helping the elderly care get freshened up, like a shower or like a bed bath. Those are most of the things that I did on that placement. So like I said, that placement was really, really tough for me. But at the end of the day, I'm glad I did. Even though that was not my first placement, while I was at college, I did have an experience of a placement. But this second placement, this happens to be a second placement for me, and was quite hard. I won't lie about that. So second placement was in a cardiac ward, and that placement, oh my god, it was of mixed feelings for me. Like, I would say two things that was good about that placement for me was that, one, it was not quite far from where I was living, and two, it opened my eyes and it expanded my knowledge in a lot of things that I would have said no about. So let's dive into it. So it was a cardiac ward, and in the cardiac ward, this ward actually deals with patients who have experienced some sort of heart failure symptoms. And when I talk of heart failure symptoms, it means maybe breathlessness, lack of mobility, or they're just not able to do so many things. So in terms of heart failure comes in so many instances. I'm not going to dive into that just now, but if you want to read more into what I'm talking about, just type in symptoms of heart failure. So when I said that placement enlightened my knowledge, enlightened my knowledge in a way that if anybody were to say to me that somebody suffers from heart failure, I would think, oh, that person is going to die. But on this placement, if you have a heart failure, it does not necessarily mean you're going to die, and does not necessarily mean that you're going to need a heart transplant. It just means that if you suffer from any sort of heart failure symptoms, this ward, they will bring you in, you'll get assessed, and most times maybe you only just need a little surgery to correct a few things that could help your heart function properly, or maybe you're going to be needing an invasive treatment at the end of the day. And at the end of the day, if it means that you're going to need an heart transplant, but it's more or less like a word which follows the journey of a patient who's actually suffered or experienced some symptoms of heart failure. So I'm just going to put it out to you out there. If anybody says to you, heart failure, you've got heart failure, trust me, you're not about to die. It just means that your heart or some systems around your heart need a little bit of push-up, needs a little bit of help to make sure that your heart functions properly. So that was my experience on that word. And that word, I would say my first day was a bit hard because most of the things they were doing it was a specialist word. So most of the things there I was not quite conversant with them. So I was given like a student nurse handbook, whereby any abbreviated word they use during the handovers, I'm able to kind of like go through it and read on my own. And then I found myself, after each shift, if I hear anything that I'm not quite familiar with, or there are some words or there are some medications that I'm not familiar with that were being used on that ward, I take my time by writing them down. And even though after a long 12-hour shift, I still find about 5 or 10 minutes later on when I get home at night to try and read through, and I find myself referring to this textbook a lot of the time. And in this textbook, like that word I was talking about, the cardiac word, it's got to do with the cardiovascular system, that is your heart. And when we talk about the heart is the engine of the body. If the heart is not functioning, every other system in your body will not function. So this textbook really, really helps me in terms of studying more about how the heart works, and what are the things that could stop the heart from working too well. So I would say my experience on that word or on that placement was that, yeah, it was quite advanced for me being a first year student. And again, all members of staff were great except for one. I know, except for one. I did, and this one, my final grade was up to her because she was going to be the one to mark me for my final grade. I did find that my first 2 weeks with her, she was not that friendly, but I think attitude towards me changed when she starts to get to know more about me. I would say probably maybe from the third week, because I was there for 6 weeks. So the first 2 weeks were like, probably she was unsure of me, and maybe for me, I was unsure about her. But from the third week, things changed, and we had a very lovely relationship. So, like I said, it was quite an advanced placement for me because they deal in specialist cases. I was able to meet all of the surgeons. I was able to observe some procedures being done. And yes, my experience so far on this place was absolutely fabulous, being that I learned so much. And one thing I would say to you is this: if you ever experience or have any sort of heart failure symptoms, please ensure you speak to your doctor straight away. And trust me, once you speak to your doctor straight away, things will roll quickly for you, because you will get seen as soon as possible. Because like I said, the heart is the engine of the body, and if the heart is not working properly, every other system will tend to shut down, and that is when, if being left too late, that is when you're going to struggle, or somebody might not actually make it. So yeah, that's my experience of my second clinical placement as a nursing student. So my third placement, which I had, was in a cardiothoracic ward. I'm sure you guys are going to be like, cardiac, cardiothoracics. So in terms of cardiothoracic, what I went to, also it deals with patients from several ages, from 16, in fact all ages of patients. This is what this word looks after. And when I'm talking about cardiothoracic, it's got to do with patients who suffer from sort of breathing or lung conditions, patients who suffer from respiratory conditions, that which means that maybe they suffered from collapsed lungs and stuff like that. So mostly patients with issues with their lungs or breathing are being treated in this ward. So which means that most of them have having to had biopsy of their lungs being done. Some patients have to had drains put into their lungs perform perfectly. So at times some patients might have to have surgery to get a certain section of their lungs taken out, so as to help them live a normal life. And some patients just need maybe a little bit of help to ensure their lungs, even after their lungs has collapsed, to make sure that they're living a normal life. So at times a certain part or an entire side of the lungs of a patient can be taken out. But trust me, even though these surgeries seems invasive, for the fact that patients are able to get help, they are 100% going to live a happy life after such surgeries. So my placement experience at this ward, I would say my first day, my first week, my first day was terrible, because I was actually made to cry, because I was asked to look after a patient who's just arrived from theater. Yes, I know the basic things I'm supposed to do when a patient arrives from theater, but at that instance, I actually understood my limitations and I decided to step back, because what I've been asked to do is way above my limitations, and I felt I wouldn't want to put this patient who's just come out of surgery, I wouldn't want to put this patient into any more danger. I'm just a first year student on my third placement. I'm not advanced, and this placement cardiothoracic ward, it is my first day. I'm being given such ill tasks to do. I felt no. I'd rather say no than cause more harm or more danger to this patient. So I mean, obviously, I was not able to do this. And one of the other registered nurses was like, "Oh, Weme, what are you doing there? Are you alright?" I'm like, "No, I'm not okay." And she was like, "What happened?" So I explained to her, and she was like, "No, Wemi, I understand the fact, and I really appreciate the fact that you understood your limitations." And and she said to me, "You know what?" She took the file off me and she handed it to the patient, to the member of staff who was actually meant to look after that patient. And she did say to them and said, "You know what? I'm going to take Wemi with me for today, so I could show her a few other things." And I'll say to you out there, that member of staff who actually stood up for me, I really appreciate you for doing that. And I actually want to say thank you for appreciating the fact that I was able to identify my limitations. So yeah, that was that. And when she asked me about how I felt having been placed in such position, before I knew it, I burst into tears. I started crying, and she was like, "No, Wemi, you shouldn't cry. You've not done anything wrong." And she actually appreciated the fact that I knew my limitations and I stood up for myself. And again, I think my second day on that placement, I was talking to one of the healthcare assistants, because it's actually good to get into communication with the healthcare assistants, because they are the ones who know the nooks and crannies of the ward. If you needed to get maybe a Venflon, if you needed to get like maybe a NASA cannula, they knew all where all of these things are kept, and you can actually learn some basic things from them as well, like maybe tidying up the beds. If a patient get discharged, what are the things you need to use to clean the beds or to sanitize everything? They need all those things. So I was actually in the corner talking to one of the staff, or one of these healthcare staffs, and one of the member of staff came was like, "Oh, if you don't have any work to do, I'll find you work." And I found that really, really, very, very rude. And I did say to this member of staff that I was talking to, that why would she talk to us like that? It's not as if we're standing there not doing anything. So obviously, I guess this healthcare assistant I was talking to went to tell this member of staff. And this member of staff, like I said again, me passing my module, me passing this placement was due to her because she was going to be the one who was going to grade me. So I think after the healthcare assistant spoke to her about what happened and how I felt about how she approached us, she called me later on in the day and said, you know what, Wemi, she didn't act, she didn't mean to act that way, that because they were, remember, short, and then she was stressed. And I was starting to think in my head, okay, if you're stressed, why would you act that way? So you're saying to me, because you're stressed, you're going to lash out at everybody you come across. What are you trying to say to me, being a student nurse who is here on my nursing placement, and it's only been my second day, you know? So she did spoke to me and she apologized, and I accepted the apology, and I said to her that, you know, it's my first day, and I really appreciate the fact that she should let me know when I'm doing things right and when I'm doing things wrong. But when I'm trying to get knowledge around people around me, I really appreciate if she encourages me to do more of that, because at the end of the day, whoever is meant to be my mentor, I can't follow them all around. I mean, there was a time whereby I was meant to be with my mentor for the rest of the afternoon. I didn't know where she went. Like, I tried to look for her for like the next 5 minutes. Since I couldn't find her, I just attached myself to another member of staff who was doing something. I felt, oh, I need to learn this. So that was my experience for that placement. And I would say, yeah, in total, at the elderly ward, cardiac ward, cardiothoracic ward, they are all full of so many learning opportunities for me. And like I said again, everything I learned on those placement, even though they were quite hard, you can't assimilate everything. I still find myself referring to this textbook. I mean, every time I talk about my nursing placement or anything about my clinical placement, I'm going to be referring to this book because it's like my Bible when it comes to my placement. Everything I heard, or every word or every procedure I heard while on this placement, I found myself going back to this textbook when I have the chance, because it's quite hard. Like, if you leave home half 6 in the morning and you don't get back home until 8 o'clock at night, it's quite hard to start looking through a textbook. But each and every time when I have the time, I found myself looking through this textbook to catch up or expand on my knowledge on things that I've learned. So yeah, I mean, this so far the placement has been great. Like, every member of staff, I've met lots of people. My knowledge in terms of nursing skills, clinical skills that I've learned, I mean, if I were to be sitting at home, or if I were not a nursing student, I probably won't have this knowledge. And I'm so glad that that is all placement for year one completed. So now that I am now in my second year of nursing, I have another 3 placements to complete in my second year. So in total, that will be, I think, about 14 weeks of placement, if I'm not mistaken. No, 3 times 6 weeks. So that's 18 weeks of placement I'm going to be completing in my second year. And if you want me to take you along on how I start on the next placement, I'll be doing so. And yes, that is my experience so far of a nursing student on placement, on clinical placement. It was quite hard, but the journey was definitely worth it. And if you have watched me till this moment and you're yet to subscribe, why don't you click on the subscription bell, give this video a like, turn on your post notification, so that every time or anytime I upload any other content, you'll be the first to get notified about it. And also, ask me any question about my nursing placement experience in the comment section. I'll be happy to I'll be happy to respond to them. And before you go, why don't you support me on this channel? You can buy me a coffee. I'll leave a logo and a link in my description bar of where you can buy me a coffee, so I could have a cup one of these on my way to placement in the morning, or when I'm sitting having a chat like this with you. So thank you so much if you have watched this video till now. Like I said, share this video as well if there's any questions, or if you're looking to study adult nursing in the UK and you have any questions you're not sure about, do not hesitate to leave them in the comment section for me, or you can also email me. I'll be happy to read from you, and hopefully I'll be hearing more from you guys. Thank you so much for staying tuned, and I'll see you all in my next video. Bye.